My name is Diane Kennedy. I'm a family physician. I've been in Luverne for 24 years.
I'm Alexis Quaid. I'm a fourth-year medical student, and I had the privilege of being mentored by Dr. Kennedy during my first few years as a medical student.
My name is Shannon Matson. I'm an LPN at the clinic. I work with Dr. Kennedy, and she is also our family physician.
My name is Kat Dahl. I'm a fourth-year medical student at the University of Minnesota. I just matched into family medicine, and Dr. Kennedy is my mom. I think my mom is a great example of what life is like as a rural family med doctor. She's got such a broad practice, seeing patients in the clinic, taking care of her own patients in the hospital, delivering OBs, working in the ER, and then outside in the community, she's working sporting events, she's active all throughout the community, and she never really takes off her doctor hat.
Just having her face out there in the community and showing that she's involved and kind of being a part of the local community is incredibly important in our small communities like Luverne. And showing that you're committed to having those relationships even outside of the clinic even strengthens her relationships with her patients when they're here in clinic. It gives her things to talk to them about, gives her things to relate with them about, and also shows that she's giving back. And as physicians, that's part of what we sign up for, is to give back to our communities and make them a better place.
I remember when I was in college before medical school, we were driving on the interstate and we approached an accident scene. My mom ended up calling the dispatch to see if they needed any help or if there's anything she could do. And they actually told her that it was a motorcycle accident and one of the people that were on the motorcycle was a pregnant woman. So she actually rushed out of her car, rushed onto the scene, and it was honestly one of the coolest things. I was like, wow, my mom is cool.
Anytime she's thanked for anything or recognized for anything, then she always says how you're only as good as your team, and always gives her nurses a lot of credit. She's a very hard worker, she's very efficient, she's got a tremendous work ethic, and that tends to just bring out the best of us.
I think one of the biggest takeaways for me in watching Dr. Kennedy in her practice as a mentee of hers is how she treats the others around her, not only her patients, but support staff and her colleagues as well. I think she has a huge amount of respect for everyone who's working with her, and it makes her clinic days go better, it makes her hospital time go much better. And I think it's something for me as a future physician. I want to be that person who has respect from their nursing staff and who asks their nursing staff questions and makes them feel like they're part of the team.
She treats everybody the same in the clinic, regardless of what department they're in. It's very important to her that we all have a good work environment and that she boosts the morale at the clinic.
I think my mom provides really high quality care just because she works so hard. She's always the first one in the clinic in the morning and the last to leave. She sees 25 to 30 patients in a day, and that's not a weird day for her, that's just a normal day. She's always willing to see patients who need to be seen, even if her schedule is already so full. And I think it's her work ethic and then the relationship she has with her patients that just allows her to provide such high quality care for those patients.
As a nurse, I know how many patients she sees a day and how hard she works. But from a patient perspective, I have never felt rushed through a visit. I have never felt like I didn't have her undivided attention. And since she's so open and caring and approachable, you always know you can call or contact her if you have any additional questions, or if something occurs to you after you leave. She has that type of relationship with you.
One of the things I really noticed when I was working with Dr. Kennedy is how close of a relationship she has with her patients, and she really knows them on a personal level. And it's definitely something I tried to emulate the last few years during medical school when I was seeing patients on my own. And now as I approach my career as a physician, I think those personal connections are so important to making sure patients feel like their problems are being heard and being treated.
Thank you, Dr. Kennedy, for everything you do for the clinic, the community, and for your friends.
Thank you, Dr. Kennedy, for being an amazing mentor for me as a medical student.
Thank you so much, Mom, for being just the best mentor. I wouldn't be where I am today without you. I am so excited to join the field of family medicine and be your newest colleague, and I hope to be as great of a family physician as you are one day.